Today we are going over hypopressive or low pressure fitness with box breathing. I want you to note that Shirley's posture is this long spine, neutral pelvis, and she also has her heels pressed like she's digging in mud and her toes up. Her upper body is elongated as well, shoulders away from the ears but still long neck, growing through the top of her head. So what she's going to do is begin box breathing, focusing on an inhale 360 degrees around, feeling the lower ribs expanding into the table and outward to the sides, and then she'll pause for a count of 5. And then after a 5 count, she'll exhale for a count of 5. And then she'll pause with the air out for a count of 5. And she's going to go through 3 cycles of this breathing, focusing on the ribs, expanding outward. You could even think about expanding the ribs out into your hands as a cue, or using a band for that expansion, going 5-second inhale, 5-second pause, 5-second or 5 count exhale, followed by a pause. The next step will be, as she goes through her cycle again, as she's completed her exhale, she's going to continue to pause, but try to reopen her ribs. So she's exhaling, and then she's going to open her ribs as if she's inhaling, feeling the ribs expand, closing her throat, closing her nose without inhaling. And then when she's ready, she'll inhale back in. So I'm going to have Shirley go through another set and talk about other cues to think about as you're going through the abdominal vacuum or the hypopressive or the low pressure fitness. So again, posture is important. So long spine, leg and foot position, thinking about the expansion through the ribs, but also the sinking of the ribs with the exhale, feeling as you're going through the vacuum, the belly is going for the ride. You'll feel the belly button pull up, but it would pull up because of the pressure of the ribs opening, not because she's using her abdominals. So again, as she exhales, she's letting the air out, her ribs are sinking. And then when she breathes in, when she goes through her vacuum again, we'll see the ribs expanding, her belly button raises up, keep going, expanding further, think about shoulders widening, and then she'll inhale.